It used to be that alcohol and cigarettes were the prime concern among teens nationwide, but with the legalization of marijuana in surrounding states, students surveyed in Washington County shared that they are experimenting and using now more than ever.
Unfortunately, we continue to see an increase in the number of kids who are using cannabis or marijuana, so those rates are continuing to go up among all grade levels. We're actually seeing a decrease in the number of kids that are using alcohol, but actually what's concerning about that is that we are seeing an increase with the younger grades. So our 6th and our 8th graders, their rates of alcohol consumption are going up, but our 10th and 12th graders, it's coming down.
The SHARP survey is conducted in school districts throughout Utah to attempt to collect relevant data for use in prevention of substance abuse among children.
Yeah, over 92,000 students took the survey this year. In Washington County, the number was over 4,000 students took the survey in grades 6, 8, 10, and 12. We try to set up an environment in which students feel safe telling us about what's going on in their life. And data show that the data are quite stable and reliable, and that students really are overall kind of telling us specifically what's going on in their lives.
The data varies from rural to urban areas, including here in Washington County, where in the past we've seen a substantial increase in the use of vaping, especially among the higher grades.
We're seeing these continual increases for a number of years with our electronic cigarettes and vapes. And finally, we're seeing those start to level out, and we're hoping that now we can start bringing them down.
Prevention and education specialists are hoping the recent age change to 21 to buy nicotine products nationwide will also help take those numbers down. Tighter regulations regarding the banning of flavors offered in e-cigarettes is also expected to curb the use among teens.
We would expect with the new laws that we will see those rates start to come down, and if we can increase even more regulation, like you say with the flavors, then we'll see a greater decrease.
Despite education and help like the Safe UT app offered to kids who feel socially isolated or bullied, attempts of suicide continue to be on the rise, especially in Utah. Mental health questions in the survey show that 10th grade students are more likely to have suicidal ideation or thoughts of taking their own lives, but are also more likely to reach out to get help. However, those in the 6th and 8th grades are at a higher risk because they don't often reach out for help.
Those increasing rates of suicide is kids' resilience and how they're learning to be independent and to deal with problems and to cope with life, the basic things that we deal with every day.
Many times the use of substances go hand in hand with a lack of coping skills or struggles.
I know it's kind of scary to see these really young kids that are already experimenting with drugs and already dealing with social isolation and suicide ideation. We know from this research, we know that most kids who start drinking have been exposed to it already by the age of 11 years old. And so if we're waiting until then to start talking to our kids about these issues, we're probably waiting too long. It's very likely that even by late elementary school, they have been introduced to substances and to maybe some of the concepts that we wouldn't have considered when we were that age.
So we would hope that everybody would take a look at their data, identify a couple areas they want to focus on and make improvements on, and then come 2021, see if what they're doing has worked. If it hasn't worked, maybe think about doing something different or doing what you're doing with more fidelity.
In Washington County, Melissa Anderson, Community Education News.